Okay, so we're coming off the tendon and going up towards that direction, and you bring your arm up as far as you can, and then there you go, apply the overpressure with your other hand and relax. And all the way up.
Nice.
Is that pressure all right?
Yeah, feels good, quite tender. Triceps.
You just keep Sorry, would you just keep moving around then?
Yeah, I just work all around that tendon and working all around the myotendinous junction again. In practice, I get the image up and just like look at where those fibers are going, and I work.
Is
all
that the right
around
direction?
Yeah, that feels good.
Nice. And one more this side. All the way up.
Yeah. So what if you wanted to treat the more proximal portion?
So you'd come down here.
Yeah.
Is that about right?
Yeah, about right, yeah.
And then you do the same with the hand, and then go to bring your shoulder.
Exactly, I just want to bit more shoulder flexion because that's going to get a bit more length to that proximal tricep. Again, this is going to be a big one, you know, if you're seeing like during like, say flexion or abduction, where that scap is moving a bit too quickly. Okay. So you're getting, say you're achieving full scapular range of motion before you get kind of full glenohumeral joint range of motion. Yeah. This scapular attachment in the triceps is big for that, because if this has an inability to lengthen, then that's going to pull the scap with it. So what we're talking about there is if we're going into flexion, and you kind of see people that get the end range scap motion before they get the full shoulder movement, normally there's a bit of impingement there, a bit of a painful arc. That proximal portion of the triceps is really, really important for that. Okay. Your hands felt really, really good there, so it's just getting the right amount of tension. More importantly, it's the loading. Okay. Loading into that myotendinous junction, that's the key point. So we're not compressing, we're loading into that myotendinous junction. That's the big
perfect.
Really.
Yeah.
So we're just wrapping up module 3. So module 3 is all about the upper limb assessment and rehab, and really kind of the first maybe 2 to 3 sessions of treating an upper limb patient. So I suppose, Sarah, first of all, what are your key takeaways from module 3 so far?
I think the simplicity of it, and pretty much the same as the lower limb, it's knowing in your own head what you're going to say before you say it to the patient. So like sometimes if like my biggest fear is not knowing what I'm going to say when it comes to it. Yeah. I think
that's for the effective explanation, is it?
Yeah. I think it's a case of working it out whilst you're going through it, and like you've said before, kind of if you need to keep going through the tests yourself so that you've got the time in your head and you can obviously giving the patient your treatment as well.
And I think the big thing with that is just getting confidence with the assessments. So once you have confidence, I know like this is your first time learning it the last couple of days, so obviously it's fairly new, but once you start doing it with some patients, it becomes second nature, and then once you've got clarity in your own head from your assessment what's going on, it's very easy to explain. And at the moment it's a bit of overwhelm because you get all these assessment findings and you can work out what they mean, but you have to really think it out because it's your first time kind of learning it. But once that kind of becomes automatic, because you just know the content that well, you process all that automatically without needing to spend all that time thinking about it, and then it gets a lot easier to explain to the patient. But I think you hit the nail on the head. That it's just nearly the exact same as the lower limb. So the system now doesn't change. You've kind of got the whole pro sport go-to physio system. It's just applying that now to different pathologies and different presentations. But essentially, with every single injury, we're just keeping it really simple. We want to find the true stressor. We want to treat the true stressor, ease the symptoms, and basically restore full range of motion, restore the ability to produce force in all directions, and then it's just graded exposure to load, and then get them back towards their ideal outcome. And it's really, really easy once you break it down like that. Obviously then in practice, when you're applying that to a specific patient, that's when it gets hard. But the system's really, really logical, straightforward. And I suppose for me, the biggest takeaways from module 3 is, like you said, it's the exact same as module 2. I think the co-contraction at the elbow joint is really, really important. So just like the knee, co-contraction at the knee is really, really important for the lower limb, or co-contraction at the elbow joint is really, really important for the upper limb. And the hand and fingers is really, really important as well, especially the mid-hand. But you're doing really, really well. I think it's just starting to process now the system and being able to apply it to specific pathologies, like when you got a rotator cuff comes in or something like that.
It's quite funny when you're actually applying some of the stuff that you've learned in that, because I'm even doing it like when I'm PTing the ladies in the gym. Like if we're going to do like a press up or something, or when we're doing a plank, you're kind of saying to them, make sure that you've got a little bit of a bend in your elbows kind of thing. So it's funny how you kind of apply it to different situations as well, and not just in a treatment room.
Yeah, and you use this so much in real life. Like, the example I always use to people when I'm explaining core contractions at the elbow is lifting a kettle. So when you lift a kettle at home, how many times do we lift a kettle and pour out water? Our core contraction at the elbow is really, really important here. And what you see with people who have a poor core contraction a lot of time is that they end up doing excessive work with the shoulder, a lot of shrugging, end up with a lot of upper trap issues, maybe then it starts compressing on the disc, and they end up with all this disc pain. But the real issue is the core contraction at the elbow. It's so important for upper limb problems. But no, I think you're doing really, really well. It's just now getting used to actually doing it and implementing it. And I think once you get solid with knowing the content, like you said yourself, it's just starting to implement it and practice it, which again, it's great. We've got the environment, the gym stuff and things you can practice on.
Yeah, it was much more straightforward as well for the lower. Like the lower were quite in depth, and I was scared before starting this one because I knew that my anatomy for this was just absolutely shocking.
Yeah.
I knew nothing. Like I couldn't remember anything from uni. Nothing from uni. Yeah, it was. So when I came into this and I started, it's actually the upper's easier for this than what it was lower, definitely.
Yeah, no, good. And I think that's really good to hear, because I think a lot of physios, and if you're watching this, you'll probably relate. I think a lot of physios struggle with the upper limb a little bit. I think at least I used to be like this, where I was really confident any lower limb, knee pain, hip pain, I was really confident in treating. But someone came in with like a shoulder impingement or a bicep tendonitis, and I panicked. I did. So like I used to always be really confident with the lower limb, but like you said, once you break down the upper limb into its basic format, what do we need the body to do, find out why they're not doing it, it actually is really, really simple to treat. And then even your complex cases now, we can make them a lot easier to treat. That's really good. So next week we're going to be going into module 4. Module 4 is going to be the lumbar spine, and it's going to be good because the lumbar spine, there's a few new things in it, but really a lot of our lumbar spine is very similar to our lower limb, which is a little bit more concentrated on the rib cage. So a lot of lumbar spine issues we're going to be very, very suspicious of something happening in the lower limb as well, which we'll get to next week. So next week we'll be delving deep into that. But I think for the weekend now and the rest of this week, it's focusing on just nailing this upper limb stuff, starting to implement it with your patients, and then we'll get into that next week.